V.K. Raju. I'm originally from Andhra Pradesh. I'm living in the United States for the last 40 years. I come back very frequently. What started as once in a year, now 3, 4, even 5 times a year. I come back to India and go to the other countries too. My love is prevention of blindness in children. As you know, 80% of our vision, of our learning is through vision. If the child loses her or his vision during childhood, no opportunity to learn, and that can be a major problem for himself or herself, to the family, and to the society as a whole. With the modern technology, especially last 25-30 years, the science and the technology, 60-70% of this blindness can be avoidable. Sometimes just very simple measure, one operation, 30 minutes could be 20 minutes. The child can regain the vision, and for the next 75 years. There is nothing comparable to this in medicine to give vision to the children. World Bank once said the most cost-effective health intervention in the world is giving vision to the children, because without learning, they fall back, and it can be a great asset is lost for the country. There is always a childhood blindness is a problem all over the world, mostly in rural and semi-rural areas and the poorer sections of the families, poorer sections. And we all do, one of the best institutions in the world is the Chandigarh, the postgraduate institute is there. And all the doctors, if we do it together, there is so much can be done and prevent children being, becoming blind.
So are we planning for any camp here?
Certainly. I met a lot of friends here, Anand from the institute, and we'll be certainly be doing planning, because our foundation, working with others is our goal, not rediscovering the wheel. Each time, you want another organization. There are 3.5 million NGOs are in this country, more than primary schools. So we don't need to start. Their existing organizations would love to do along with them.
Punjab, Haryana and Tri-City, what are you planning for that?
We'll do the same thing what we are trying to do, because Professor Saluja, the editor of Indian Panorama, is the one who got interested in this eye foundation and asked me. That's why I'm here. People who cannot afford eye with the others can do only little, but each state governments, they're all trying to do more and more. So we'll screen them, and as much as we can do, we will do it.
So what are the causes behind this regarding this eye blindness?
Yeah, as we discussed, children can be born with cataract. Children can be born with glaucoma. Above all, children in the schools need a pair of glasses. So if we check them yearly in the Western countries, every year all the children are screened. In this country it is happening too, but it should happen to 100% of the children. That is our goal. We'll do our best. We'll work with other organizations. Yeah.
So लीजिए आपके सामने मैं पेश करता हूँ Dr. V.K. Raju, a very eminent ophthalmologist, जिसने कितने ही बच्चों को आँख की रोशनी दी, नई जिंदगी दी, क्योंकि ये मानना है इनका कि एक बच्चा अगर अंधा होता है तो सिर्फ वो अब वही नहीं तकलीफ उठाता, उसके आसपास के जो लोग हैं, उसका जो परिवार है, वो भी तकलीफ में रहता है, समाज भी तकलीफ में रहता है, तो बहुत जरूरी है कि इस अंधेपन का इलाज किया जाए. तो डॉक्टर राजू is here, and let me present to you my friends, Dr. V.K. Raju. Can I request you to give him a big applause? Thank you.
Professor Saluja has been supportive of our work of the foundation, which started in 1977. The Rotary International, one of the oldest clubs in the world, the first club, Rotary International, is in Calcutta club on 1st and 2nd of January. They are having the meeting, and they asked me to talk about blindness in children. It all started when I came to India on a vacation. One farmer asked me to look at his eyes, and I did not have any instruments. You can hear me okay?
Yeah.
Yeah. So on the next year, after going to United States, I came here to do an eye camp. In the eye camp, we're talking about 77. I could not believe how many children, mothers holding the children, asking me to do something about their eyes, and I did not have all the equipment for the children. At that time, all the technology is not available too. So with that introduction, why he started the program when they came for a vacation, and when I saw a farmer, then the mothers holding their children, we are talking about 77, 78. Since 1991, when India is exposed to free market society, things have changed enormously. You know, it is a truly remarkable change. You know, I'm going to give there, so I want to just do the eyeball is like a camera. The camera has a lens, less like a wristwatch. We have a crystal in front, and the eyeball has a cornea. You always hear about eye bank. Truly, eye bank is corneal bank. Still, there is no eye transplant, but the incredible science is coming. Nowadays, in the next few days, if we understand all the genes, anything is possible. And sometimes there's some sayings in Upanishads. Anything which all the brain or the mind is the limit. Anything, if we really want to do it, we can do it. And the mothers always said that one. The most commonest vision problem is people needing glasses. 1 billion people are walking on the planet without the glasses. They cannot afford the exam, or they cannot afford to buy a pair of glasses. There is 1 billion people. But a child, if he cannot afford a pair of glasses, he can't see the blackboard. His education is not complete. If you don't get education, everybody will exploit you, and 80% of our learning is through our vision. Think about that. 80% of our vision is all because of the eyes. If you don't have the eyes, you are left behind. And you can see the coast where this is today. We're not talking just about India or one state or one area, my mother tongue or village. The entire world is a small little village. You all heard about cataracts, right? Cataract is like aging phenomenon. We all get cataracts after 50s and 60s and 70s. Even children can get cataracts. They can be born with cataracts. Here is a child. We already did the surgery on the right eye. Left eye, she's waiting for the surgery. And here is a girl. She was in the blind school because her vision is poor. See all the blind schools in the Western blind school, and she finished college. You can see one side there's a cataract, those are all cloudiness. Cataract is clouding of the lens of the eye, and once it's done, this girl's college. That is the impact of what we can do for the children. You can see here, this child has born with scarring of the cornea. The front of the eye is like your wristwatch, has a crystal or a plastic or a glass in front. If that becomes foggy, you can't see the time. In the same way, cornea, if it is cloudy, she's born with it. It is a gene problem. That all can be done exceptionally well. In the last 25-30 years, we have incredible advances, but we must reach those children who cannot afford. And you can see on the right side, if you want just to switch off that lights there, probably you can see better. Anybody can switch off those lights? Yeah. Cornea should be removed. And in olden days, we did not know how to store. We have to do it 24 hours. Now, we can up to 5 days, we can store, send it to anywhere. United States sends corneas to so many countries because the system is evolved very well there for a long time. And you can see in this picture, this patient had infection, bad one, lost the sight, and the corneal transplant is done, the vision comes back. You know, in the media, something like that, operation is done, patient gets the vision, it makes a big news. But what should be is, we can prevent so many infections. So many things can be prevented by doing something, reaching these people early. Another one, have you heard about a condition called glaucoma? There's a high pressure. Normally, normal pressure is there. If the high pressure, usually after 40, 2% of people, 2 in 100, can get high pressure. So every one of you, after the age of 40, at least once or at least once in 2 years, you should get your pressure checked. Glaucoma. If it is caught early, it can be treated early. If it is too late, you could lose the vision. I have seen some doctors who are blind, not the eye doctor, other doctors who got blind because they never got checked. That's called glaucoma. It's so important that all over the world is a problem, but today, if we catch them early, treat them very early, and no need to be blind, and that can happen people, 2% of people over 40. And it can happen in the children too. So we talked about cornea, the front of the eye, we talked about the pressure, we talked about cataract. This is another one, premature babies. Babies who are born before the 9th month. 3.5 million babies are born each year in this country, much earlier. You know, sometimes like a joke we say, oh, they don't want to be in the mother, she wanted to come early to the world, you know. The baby wanted to come soon, they doesn't want to wait till 9 months. Like a joke we say. Those are premature babies, they have eye problem, they give oxygen, and if we don't do such a things right, look at the retina in the back of the eye, they can be blind. And that is our very important, because one exam, when there is a baby is in the hospital, one laser treatment, only 15-20 minutes, or one injection of modern medicine, all these things did not exist 15-20 years ago. If you do, you can prevent that baby from blindness for 75.
Global Medical Missions Hall of Fame has, for the past 4 decades, been on a crusade to eliminate avoidable blindness in those areas of the world plagued by poverty and poor access to medical care. Dr. V.K. Raju says that if blindness is preventable, then let us do it big. Huge might be a better way to measure the impact that V.K. has had on impoverished parts of the globe. Since returning to his native India in 1977 to offer his first eye camp, V.K. and the organization he created, the Eye Foundation of America, has served some 2 million patients, facilitated more than 600 physician exchanges, trained more than 200 ophthalmologists, and performed 300,000 vision-saving surgeries in 21 countries, including Nepal, Cambodia, and Afghanistan. The World Health Organization estimates that one child goes blind every minute, and that 1.4 million children are blind worldwide. Given that vision impairment is especially detrimental in children because up to 80% of early learning occurs through vision, VK's work is critical. The World Bank has said that combating childhood blindness is the most cost-effective health intervention. Among the efforts that the resident of Morgantown, West Virginia has undertaken includes delivering vitamin A supplements to children in developing countries for just a few pennies per dose, and working with Johns Hopkins University to find the best and most efficient ways to deliver those supplements. The man who earned his medical degree from Andhra University in India and completed his ophthalmology residency and fellowship at the Royal Eye Group of Hospitals in London, England, has lived in Morgantown since 1976. Running a private practice at the Monongalia Eye Clinic, he is also a clinical professor of ophthalmology at West Virginia University and the section chief of the ophthalmology department at Monongalia General Hospital. But more than anything, VK's sight is focused on the poor. Whenever VK performs LASIK surgery in this country, a surgery to get rid of glasses, all of the proceeds are used to purchase glasses for those in other countries. A fellow of the Royal College of Surgeons and the American College of Surgeons, VK also brings his missionary work to his West Virginia office. This is Srinu Madula, who came from India at the age of 2. He was legally blind. The child underwent corneal transplants on both eyes in Morgantown under VK's caring hands and returned 2 years later for a follow-up exam. Here's the real follow-up, an everlasting testimony to VK's kindness. This is Srinu with his mother back in the United States some 20 years later, having just completed his doctorate in pharmacy from Rutgers University. That Srinu's grandparents lived to see his graduation was special. That the young man was able to see their reaction was unforgettable. The impact that VK has had is simply amazing. Meet Deepa, whom VK first met at the age of 2, suffering from crossed eyes. Here's Deepa at her wedding 19 years following surgery. Vision restored, she is now a mother with 2 children of her own. This youngster had developmental cataracts. VK performed bilateral cataract surgery when he was a boy of 10. The young man went on to graduate from college. As one would expect, the honors that have come his way for his efforts are many. The American Medical Association Foundation presented him with the Dr. Nathan Davis International Award for Excellence in Medicine.
You know, there is an old saying, you don't want to reinvent the wheel, right? Wheel is already there, you don't need to reinvent the wheel. Even in other countries, in Ghana we have a very active program, and a few other countries, especially in Afghanistan. I was there 3 times, but later my host said not to come because things, at that time when I went there, it was so, we were walking on the street in the evening, no problems at all, 2002, 2003, but it got worse. We have a very active program, we sent a lot of, Afghanistan was hurt very badly. We want to work with existing organizations, for example, Indian Ophthalmic Society, I come and teach, we'll work with them, and a lot of, especially Rotary clubs, because I've been Rotary clubs for the last 39 years. I joined, and it's a Rotary is doing something about yourself, that's right. There's no more polio because of the Rotary club's persistent. Work with everybody else. I am Dr. V.K. Raju. I am a professor of ophthalmology in West Virginia University and the president of Eye Foundation of America. You are watching the Vision News, and a Happy New Year to every one of you, and best of health. Thank you.